I am a research analyst here at Canada Health Infoway on the performance team. I'd like to thank you all for joining our webinar today, where we will be discussing patients accessing their health record. Please note that this webinar is being recorded and that the materials, such as the slides, will be posted on our website at the completion of this webinar. Before getting started, I'd like to complete our land acknowledgement. So we acknowledge that the lands on which we gather for this event are the traditional territories of many Indigenous nations. Canada Health Infoway recognizes that the profound and ongoing injustices experienced by the Indigenous peoples on what we now call Canada, which continue to impact their health and well-being. We honor the resilience and strength of Indigenous communities and their rich cultural heritage, which contributes to our understanding of improved health outcomes. I invite all attendees to reflect on the territories from which they join us. Let us commit ourselves to deepening our understanding, fostering genuine relationships, and actively contributing to reconciliation efforts. Together, may we strive to create a future of respect, understanding, and partnership with Indigenous peoples. Moving on to our agenda. So we have 3 great presentations lined up. Following my introductory remarks, we will hear from eHealth Saskatchewan, where we will receive a walkthrough of their provincial patient portal, MySaskHealthRecord. Following that, we will hear from a patient about her experience accessing her personal health information online, as well as her personal health records. And then to finish off, we will present results from the 2023 Canadian Digital Health Survey. As usual, we will save Q&A for all presentations until the end. Participants can feel free to send any questions they have through the Q&A feature in Zoom throughout the webinar. I will moderate all of these at the end, and hopefully we have time to get through them all. So moving on to our welcome and introductions, a big welcome to all attendees that have joined, new and returning. Briefly for new attendees, these webinars connect jurisdictional leaders, evaluators, and researchers to share best practices, results, and other insights focused on evaluation in digital health. If you are not already on our distribution list, I invite you to get on the list and stay up to date with all of our upcoming events. So now on to our first presenter, Gord Smith. Gord Smith leads eHealth Saskatchewan's Citizen Services team. They're responsible for supporting operations and enhancements to Saskatchewan's patient portal, MySaskHealthRecord. During Gord's tenure at eHealth, he has supported the growth of MySaskHealthRecord users base to nearly 60% of Saskatchewan's population. He's also assisted with the launch of a mobile application version of the platform, as well as the completion of numerous platform enhancements. All of these are done in an effort to ensure timely and fulsome citizen access to their patient health information, personal health information. When you're ready, Gord, feel free. The floor is yours.
Okay, great. Thanks so much. I'll just share up my screen here and get started. Okay, hopefully everybody can see that. So, thanks so much for inviting me here to give an overview of the work that we've done here to deliver electronic access to personal health information for Saskatchewan citizens. This is our agenda for my presentation. We're going to take a quick look at our learning objectives, background of MySaskHealthRecord. We'll take a look at the current state and benefits, as well as looking at some recent and future enhancements. We'll take a quick look at some user stats and profiles, and then, as mentioned earlier, we'll save some questions till the end of all presentations. So, learning objectives for my presentation today will be to become familiar with the creation and development of MySaskHealthRecord, understand the current state of access and functionality within MySaskHealthRecord, understand the benefits of access to their information by citizens here in Saskatchewan, as well as elsewhere, and become familiar with current structures and processes that govern MySaskHealthRecord, as well as its future plans. So what is MySaskHealthRecord? It is a free and secure website enabling patients to view their personal health records and manage their own health information. Launched in 2018, MySaskHealthRecord is currently available to patients 14 years and older. Parents and caregivers can also access health records for children and dependents under 14. And as mentioned, our current users are just over 700,000 and pretty close to 60% of the population of Saskatchewan. So in 2015, eHealth partnered with TELUS Health to build the portal based on their IPHR platform. And in 2018, the pilot was launched with 1,000 select users and was well received. So as a result of that, we received approval to expand the program provincially in 2019. And at the time, hopes were for about 135,000 users. So we have done quite well based on that metric. In 2020, due to pandemic, we introduced COVID test results as well as proof of vaccination certificates, which greatly expanded our usership. As at the time, Saskatchewan did require proof of vaccination in order to access services in the province. Also in 2020, we added a temporary option for parents and caregivers to access their children's personal health information, which is now current state. When MySaskHealthRecord was launched to the public, there was a system that used mailouts of PINs to users to as an added level of assurance. However, this was temporarily suspended during pandemic, just to allow users to register quicker and easier. And then this practice was permanently removed in 2022 following security reviews. Though we do have more future work around improving our assurance level and with activities like two-factor authentication, password resets, and a few other things that we're looking at. In 2023, as mentioned, we added our mobile version of this portal for easy access on the go, as well as enabled our bidirectional flow that will allow us to bring back user data to eHealth repositories, such as healthcare directives and contact information. Last March, we went operational with surgical procedure information, and in the coming months, we will roll out our second and final phase of the Open Clinical Documents project. So MySaskHealthRecord provides, within the portal, we provide access to patients' laboratory results, medical imaging reports, immunization history, prescription history, a clinical visit history for any of the acute care facilities in Saskatchewan. Select clinical documents are available right now, and as I mentioned, we're working on getting the balance of those available in the portal, as well as recently added surgical procedure data. So this allows our patients to track and self-document their health information, and they also have the option for adding any user-generated data for any connected devices like Apple Health Kit, blood pressure monitoring, and others. In order to register for an account, we leverage Saskatchewan government authentication services via the sask.ca account. So the sask.ca account gives citizens access to various government services like fishing and hunting licenses and notary public services, as well as MySaskHealthRecord. Requirements are that users have a unique email address, be 14 years of age, have a valid SGI, which is Saskatchewan Government Insurance Identification, which is oftentimes their driver's license, and then also having an active Saskatchewan Health number. So as mentioned, we allow access to child health records. So in order for patients or guardians to access, they must request access to their health records through our privacy and access department. The child or dependent must be under age 14, and parents or guardians must have an individual MySaskHealthRecord account themselves in order to link their child's account to them. And then the parents submit an access request form, and as well as various other supporting documentation to privacy and access here at eHealth, and then they link up the accounts. The dependent access is granted upon that manual review and approval. And once those children reach 14 years of age, they are emancipated, and then they would need to in turn create their own health account. So take some quick look at some of the web application. Take a look at what it looks like for those not in Saskatchewan. This is what our portal looks like at the moment. This is a home screen of the web application where most users land and navigate to the information they're seeking. So along the left, there is tabs that house individual widgets that organize all the personal health information. At the top of the page, there are notification tiles for pertinent, timely general user information, like how to access your child's health records and other timely information that we have in the portal. This is the medical records page, and the medical records page houses all of provincial health data. So provincial health data is denoted by having a green bar along the side of the resource there. As mentioned, we do allow for self-entered data, and if users enter their own self-entered data, that's denoted by a yellow bar just to keep them organized. The most accessed information in MySaskHealthRecord right now is lab test results, and then followed by medical imaging reports. On the bottom right-hand side of the screen there, you can see a little green plus sign. That's the little plus sign that allows users to enter their own data, such as on this personal health summary page. So if they have any family history or medical conditions or procedures that aren't accounted for, or any allergies, they can enter this data here and keep that for tracking purposes for themselves, as well as for anyone else that they've allowed access to their account for. The measurements page allows, again, self-entered data, as well as data collected from connected devices, and that connected devices shows up in red there. And that's things like, again, Apple Health Kit, blood pressure monitors, and all kinds of different devices that can hook up and bring that data into MySaskHealthRecord. The scheduling page, this is where we have the newest data within MySaskHealthRecord. You can see the surgical procedures is highlighted there. Surgical procedures details completed and upcoming surgeries for users in the province. So they have access to any upcoming and historical surgery once they have seen their specialist. So this is for waitlist too. So once they've seen their specialist and then they are on the waitlist to receive surgery, that would appear along the bottom of the screen there. Notable exceptions to this would be endoscopies, as there's a little bit of work in the province to just consolidate some of that source systems so that we do have good data to provide to people, and we have plans to do that in the future. And as well as emergency procedures. We don't display those until those are completed because oftentimes when people are in hospital, the dates and times of emergency procedures can change rapidly, and it wouldn't be great information until it's completed. So this functionality will also pave the way for future work on a referral module. So once patients have seen their primary care specialist and then they're they can track the referrals to their specialists, at which point they would show up in the surgical procedures. The users can set their preferences within their preferences pages for tracking of chronic conditions like high blood pressure, diabetes, as well as adding height and weight for tracking over time as well too. Users also have the ability to create custom dynamic reports and download them and print them. And this is especially useful if someone is moving away from the province or needs to keep a record of their PHI. So if they leave the province, they would no longer have access to MySaskHealthRecord, and they could take all of this information with them and potentially add that to whatever other personal health portals that they may have with their new residents. Users are also able to share their account data with others that have an account, and they can share this on a very granular level. Someone they trust, family, a caregiver. This is especially useful for older individuals that aren't tech savvy, and kids are looking after their personal health records and tracking their health with them. They can also share it with clinicians or providers. People can set limits on what kind of data is accessible. They can do read-write or just read access. And as well, they can revoke that access at any time. The My Profile page allows users to update their contact information. And again, as mentioned, we have the bidirectional flow enabled that will be able to, in the future, bring this information back to eHealth data repositories that will potentially allow for a quick way to update user profiles and integrate with other eHealth programs or systems. And also potentially we would use bidirectional flow for things like healthcare directives and stuff like that. As mentioned, we have a mobile application, and here is a quick view of what that looks like, just some screenshots from that. The mobile application does mirror all functionality that is on the web application. We're going to take a quick look at our current state and benefits. In discussion with patient family partners, which is an important part of our governance team, we found that various benefits have been noted to patients, specifically being better prepared for their appointments, being involved in managing their own health in partnership with their healthcare providers, an improved understanding of their health by having it there at their fingertips. We also noted that patient stress levels have improved as a result of having access to their own information. And access to their health information when away from a home and abroad is very, very handy for, Saskatchewan does have a lot of snowbirds that leave in the wintertime for warmer climes. We'll take a quick look at some of our recent and future enhancements. But in order to facilitate these enhancements, we rely on our governance model. So we have a working group comprised of clinicians as well as and other providers, as well as patient family partners that make recommendations up to our steering committee. And our steering committee has representatives of all health system partners, including the Ministry of Health, Saskatchewan Health Authority, Saskatchewan Cancer Agency, Saskatchewan Medical Association, 3S Health, as well as good representation from patient family partners. So their role is to set strategic direction and remove any obstacles that are faced by the working group. Ultimate decisions on the program governance is with the Deputy Minister and CEO Council level. Some of those recent enhancements that that I was talking about, again, the mobile app that allows access at anywhere for people as long as they have a data connection. Surgical wait list. Open clinical documents is a project that we've been working on for a while. And this will increase access to relevant clinical documents to promote patient participation and also to promote transition continuity of care. We are looking at a provincial digital front door in Saskatchewan, and we will look to integrate MySaskHealthRecord as one of the major pillars of the digital front door in the future to improve user experience. And also, as mentioned, healthcare directives. We're working on the ability to upload for users to upload a current healthcare directive, potentially to be accessible by providers within our provider portal. So a quick look at our user stats and profiles. Approximately 58% of the province, closing in on 60, has access to MySaskHealthRecord. Total records as of yesterday were 700,093. That does include just around 43,000 child records. We average about 90 to 100 new registrations per day, give or take, depending on the day. And analytics of our user base shows that we have active registrations across age groups, with the most active being females aged 35 to 44. We do have the ability to monitor what is important to our users on a real-time basis to aid in the future enhancements. And we have noted that Saskatchewan residents access the personal health information from all over the world in user time. So that's my presentation. If after any questions are fielded at the end, if people feel that they have more information, are looking for more information, or wanted to get in touch and chat about some things kind of more in depth, feel free to contact me. I'm pretty sure that this deck will be shared around, and my email address is there. So again, feel free to reach out to myself or my director, Diane Dolney, and we'd be more than willing and happy to share any of our experiences that may help others along in this journey. So thank you very much. I will turn it over to Therese and the next presenter.
Thank you, Gord. Awesome presentation. Moving on to our next presenter, it will be Jenna Kedy. Jenna Kedy is a 20-year-old university student. She's a passionate chronic illness warrior and dedicated advocate. Having navigated the healthcare system since childhood, she has become an avid patient partner committed to improving patient care. Jenna volunteers extensively in her community and actively promotes the implementation of advanced technology in healthcare. Today, she will share her story to inspire positive changes and better support for individuals facing similar challenges. Go ahead, Jenna, when you're ready.
Hi, everybody. Thank you so much, Therese, for the lovely introduction. My name is Jenna, and I am from Halifax, Nova Scotia. That's my lovely slide. And when I tell my story, I like to tell it like a storyteller. And it's not going to be, I'm not your traditional you're going to see in these types of webinars. I don't like to be super strict to the book and like to have an open mind when I tell my story. So I'm thrilled to be here with all of you today, whether it's morning, night, wherever you live. I hope that you're having a fantastic day. So as said, I'm 20 years old and I proudly carry the title of a chronic illness warrior and a professional patient because I've been navigating this system for 20 years and I am 20 years old. So it's been my entire life. This is all I know. So I proudly carry that title of being the chronic illness warrior. And I come from Halifax, Nova Scotia, all the way on the East Coast, surrounded by the ocean. So my journey in the healthcare system has deeply influenced every single part of my life. It has molded me into the resilient person I am today, but also I've faced many challenges, and that's why I'm so dedicated to this space. Living with chronic illnesses has given me a unique perspective, one that has been honed through navigating the healthcare system since I was younger. For the past 5 years, I have dedicated myself to patient advocacy, public speaking, and forging partnerships with different people in the healthcare system as well as other patients. I am very passionate about sharing my story to shed light on the real, raw experience of young patients. I want to be that face to a patient. Whenever you hear the word patient, it can mean so many things. And I'm one of those people that is real and raw and navigates this system. And I also want to advocate for positive changes along the way. Accessing my own health information has been a monumental challenge in my life. Frankly, I don't even know where to begin to access crucial details about my own body and health. And I walk around in this body every day, so I feel like I should be able to find this information a little bit quicker. I've heard that it often comes at a significant financial cost, and when I ask questions about this, my doctors have handed me stacks of intimidating paperwork that I don't understand any of the language on over the years, but even my own healthcare team has struggled to fully explain to me the complex processes involved with accessing my health information. And 2 years ago, I made my big leap. I transitioned from the pediatric system over to the adult system. And nowadays, I find myself even grappling to find the basics. Simply trying to reach members of my healthcare team is exhausting. Countless lost phone messages and frustrating hangups have become a regular part of my weekly routine. This struggle has at times forced me into unnecessary emergency room department visits, which not only compromise my health and well-being, but also contribute to the cycle of the delayed care and worsening health. Imagine if I had access to my own health results and reports. It could transform my life. As a young person equipped with a phone and some pretty tech-savvy skills, I firmly believe that our healthcare system should leverage readily available technology to grant individuals like me seamless access to their own health. Here are some of my recommendations that we should be doing on a national level, but of course, start provincially. Firstly, we need a streamlined, user-friendly system for patients like me to access their health information electronically. This system should be intuitive, ensuring that patients can navigate it independently without unnecessary hurdles, and making sure that people like me, the patients, are a part of creating these platforms. Secondly, healthcare providers must be equipped with the tools and training to effectively communicate and educate patients about accessing their health records. This includes breaking down the complexities of medical jargon and paperwork into understandable terms so your average Joe will know what they're talking about. Thirdly, the healthcare system needs to prioritize the integration of technology that supports secure, real-time communication between patients and their healthcare teams. This would reduce the awful frustrations of missed phone calls and improve the continuity of care. Fourthly, I feel there is a critical need for transparency regarding the costs associated with accessing personal health information, because I've always been told it's very expensive, never been told a number, but it's always kind of a lost story there. And as someone that's a university student, hearing something costs a lot of money is daunting and scary. Patients deserve clarity on fees and should not be burdened financially simply obtain information about their own health. Lastly, we must foster a culture of patient-centered care, where the voices and experiences of patients like me are not only heard, but actively incorporated into policymaking and system improvements, making sure that we are included at every single, when you have a light bulb moment, get the patients involved, get us involved right to the end of the journey, getting mixed perspectives from different patients of youth and older adults, and making sure that everyone has a voice at the table to make sure everything you're doing is patient-centered. In closing, I urge all of us to envision a healthcare system where access to personal health information is no longer a privilege, but a fundamental right for every single Canadian. Together, let's work towards a future where technology empowers patients, enhances communication, and ultimately improves health outcomes for all. Thank you guys so much for listening.
Thank you, Jenna. So just a reminder to everybody, if you have any questions, please submit them in the Q&A feature, and we will make sure we share or go through these at the end of the presentation. So on to our final presentation. It will be from Infoway's own Waldo Beausejour. Waldo Beausejour is a senior analyst on Infoway's performance analytics team. He will be sharing our latest survey results from the 2023 Canadian Digital Health Survey. Go ahead, Waldo, when you're ready.
Okay, thank you. Let me go ahead and then switch to presentation mode. Okay, hi everyone. My name is Waldo Beausejour. I am part of the research and analytics team at Canada Health Infoway. So the first presentation gave you an idea of a provincial online patient portal. So it highlighted some of the benefits of electronic access to personal health records. The second presentation gifted you with a lived patient experience when it comes to accessing electronic health records. Now, what about you? How was your experience like as a patient accessing your health information? By the way, have you ever accessed your personal health information online? These, ladies and gentlemen, are some of the questions that we at Infoway, we ask Canadians every year. And today, I have the privilege of presenting Canadians' experience with accessing their personal health information online based on the 2023 results of the Canadian Digital Health Survey. And I think this will give you an idea of the current state. Now, some of the items that I will cover throughout the presentation will include, number one, we'll take a look at patients' experience accessing their PHI online, personal health information. Number two, we'll get a sense of how Canadians are experiencing care coordination and collaboration. And lastly, we'll take a look at their perceptions about communication amongst HCPs. Now, the results and findings that I'm going to present are based on Infoway's cross-sectional survey called Canadian Digital Health Survey. It's an annual survey, and it collects data on a variety of topics ranging from uptake to digital health services by Canadians, interoperability landscape, digital health literacy, just to name a few. It's an online survey, and in 2023, we achieved a sample size of 10,000 and plus Canadians across provinces and territories. And respondents, they were recruited from an online panel that is owned and managed by a market research firm that we hired. And in this case, it was Léger. Now, this map provides the regional breakdown of the total sample that we achieved in the last iteration of the survey. And if you are from Saskatchewan, the sample size achieved for your province was 292. If you are a resident of Ontario, like me, the sample size was 3,800 and plus. Et pour nos voisins du Québec, nous avons complété une taille d'échantillon de près de 2,305 répondants. Now, the first part of the presentation is about access to PHI online, starting with the interest in and access to PHI. So the survey revealed that 81% of Canadians are interested in accessing their PHI online. However, only 39% of them could access or have accessed their electronic health records anytime in the past, leaving us with a gap of 42%. Now, bottom line, interest does not necessarily lead to actual access. And this could be for a slew of reasons. Now, on the right-hand side, the line chart shows a steady increase in access to electronic PHI over time. So we started at 4% in 2014, and now we are sitting at roughly 39% in 2023, with an average growth of 30%, I would say, for the period under observation. Now, for those with access to their PHI online, we've also asked them whether they were interested in contributing data to their own electronic health record. And 45% of them showed interest. And this contribution can be done through solutions or technologies like Fitbit, Apple Watch apps, wearables, etc. Now, what are the sources or platforms Canadians are relying on to access their electronic PHI, their electronic personal health information? Well, 45% rely on provincial and territorial portals. So the 5% that you are seeing for MySaskHealthRecord is based on the overall sample size. But if we were to use the total sample achieved for the province, it would be 96%. So the way we should interpret it is 96% of people in Saskatchewan are relying on MySaskHealthRecord to access their health information. Now, 29% of Canadians are reliant on lab service provider to access their PHI. And lastly, 16% use portals offered by their healthcare providers. In terms of the pieces of information they can access through their online sources, Canadians are more likely to access their lab tests, diagnostic results with 84% access, followed by immunization history records, 51%. 40% of Canadians access their list of current medication and medication history, 23% access patient visit summary, and lastly, 20% access specialist consultation notes or records. Now, to give you an idea of the sentiments around access to online PHI, we have collected some perceptions. For example, 92% of Canadians agreed that online or the online source or patient portal where they access their PHI is credible and trustworthy, which is really important. Another example is that 86% of Canadians reported that the online source was easy to use. Why is it important? Why ease of use is important? It's important for inclusivity because we want everyone to be able, we want every Canadian to be able to access their health information online. Another example is 83% of Canadians reported that they can better manage their health because they can access their PHI online. Remember, we want Canadians to access their health information, not just for the sake of accessing it. We want it because we want them to better manage their health. So that's why this result is really important for us. Now, when it comes to the benefits of accessing PHI, we have some that we collected from the survey. Number one, we have 45% of Canadians who reported that they were able to avoid an in-person visit with a family doctor or regular place of care or to a walk-in clinic in the past 12 months as a result of accessing their PHI electronically. And we found out that 34% of Canadians, they were able to avoid an in-person visit to an emergency room in the past 12 months because they were able to access their PHI online. Now, the second part is about connected health and coordination of care. Starting with the Canadians' perceptions about current state of PHI storage, access, sharing, and management of by their healthcare providers. Now, one thing that we need to highlight is 85% of Canadians, they reported that they agree with the way or the way their PHI should be shared among HCPs. By agree, we combine strongly agree and moderately agree. 82% of Canadians reported that they want new and innovative technologies that will allow their HCPs to communicate, access, and share their PHI among them. And lastly, 69% are happy with the current state of their PHI access and sharing among their HCPs. Now, moving on to experience with gaps in coordination of care in the past 12 months, we found that 50% of Canadians reported that their HCP did not always have access or always have access to their information prior to meeting with their HCP. So this is coming from the 2023 survey results. Now, when it comes to more detailed information about their experience or the gaps they've experienced, we found that 42% of Canadians reported that they have experienced gap in coordination of care on clinical communication. And these gaps are characterized by either they had to repeat their information to different HCPs, 25%, or there was a communication issue or delay. 22% of Canadians reported this as a problem, or 19% reported that their HCPs were unaware of recent or previous visits with other healthcare providers, just to name a few from the list of gaps experienced by Canadians. Now, when it comes to repeating information to HCPs in the past 12 months. So Canadians reported that on average, for 28% of their health encounters, they had to repeat their information to different healthcare providers. And this, ladies and gentlemen, this single stat underscores the needs for a more connected healthcare system through better interoperable solutions. Now, what should we take away from this? Well, the findings showed that the high interest in electronic PHI did not translate in high access. We've seen 81% interest, but only 39% access. And again, this underscored the needs for the implementation of initiatives that will improve patient access. And Infoway is working with our PT partners, provincial and territorial, and other stakeholders through our shared interoperability roadmap to enable patient access to their health record. Now, when it comes to the perceptions, as you have seen, perceptions about PHI platforms among connected patients tend to be highly positive. So curbing the gaps, the access gap, may require enhancement of digital health literacy, which will be an enabler, along with awareness of the PHI platforms. And this access to PHI is crucial for patients to be able to converse and connect with their health providers around their own health. Thank you for your attention. Now, if you want to get more insights about the survey results, I strongly recommend that you visit our website, and we have this interactive data and analytics hub that you can take advantage of, where we provide more results and more findings from the survey. Thank you, and back to you, Therese.
Thank you, Waldo. Okay. So we have gone through all our presentations. We are just now going to go through our Q&A session. So I've seen that Gord has been able to tackle some questions in the chat. Would you be able to go over a few of your answers briefly? Everyone can just hear.
Sure. Let me go back to the beginning here. In Saskatchewan, if a patient enters data in the portal, can providers see it or just the patient? So it is just for the patient and whomever they have shared their record with. If they did share it with a provider who has a MySaskHealthRecord account, they would be able to share it that way, and indeed some people have, but the individual account holder has the ability to share it with whomever they want and only whomever they want. So it basically does just stay in their account unless they have shared it with them either electronically or potentially even using a PDF and paper and sharing it that way. Height, weight, and is the height, weight, and tracking data visible? It is visible only to the user, and then again with whomever they've shared it with. So none of that information comes back to any repositories right now that would be shared more widely, like with providers. Sharing data outside the province. So yeah, as of right now, sharing data electronically can only happen between account holders. So sometimes people who have had an account within Saskatchewan have moved away, and then they're after 90 days, technically their access to MySaskHealthRecord would be severed. So for situations like that, people would be able to potentially download PDF reports of their information and share them electronically via email or other ways. But yeah, as of right now, current state is the only ability is to share from MySaskHealthRecord account to MySaskHealthRecord account. When you began your rollout of primary care provider, did your primary care providers voice concerns about patients receiving their results prior to them or being able to review the results? Yeah, those there was a lot of feedback around increased workload for various data types, including clinical documents. We did a few things where we had instituted a technical way for providers to withhold results from MySaskHealthRecord, and that's specifically for open clinical documents. So if they feel that it is problematic due to HIPAA concerns, they have the ability to not send it to MySaskHealthRecord. However, it does stay as part of the patient's chart, and providers still have access to that within the provider portal, which is our EHR viewer. Other types of documents and data like lab results and medical imaging results, there is delays on some of that information, specifically pathology reports. There is a 96-hour delay on pathology reports that allows providers to have maybe some difficult discussions with patients before they see those results, just to to try and head off some of those panicked phone calls to providers before providers are even aware that those results are in there, because MySaskHealthRecord gets the information very quickly. So we did something like that. We also have done a lot of studying about other jurisdictions that have introduced personal health information, and the data that is available in practice does seem to say that patients' access to personal health actually reduces the amount of stress, reduces the amount of questions to providers, and in a lot of cases can reduce provider workload. Question about MySaskHealthRecord. Does a patient profile page allow for patients to enter information or data they feel is helpful for their care team to understand? So yes, definitely. You can add information in various places under like medical procedures. You have the ability to put in information in your family history and make other notes and add in allergies, add in emergency contacts. And any of that information can be shared with anyone else that you're sharing your records with. You have the ability to share exactly what you want to share with others. And if it was just that information, you can do that as well. You can get very granular about it. Is the platform available as a white label solution? Yeah, this platform, the IPHR platform developed by TELUS, is their instant personal health records. Alberta uses this platform for their My Health records. Saskatchewan uses it. Any other province or territory would be able to use that platform and have it tailored to their needs exactly the way that Saskatchewan has done. Does the MSHR portal deal with records that are exempt from disclosure per privacy laws? Again, that is that situation where we have instituted that technical ability to withhold or exclude information from MySaskHealthRecord based around the provider's ability to click a button and say, yep, this won't flow, based around any HIPAA requirements that would allow them to withhold that information. Again, patients still have the ability to request that information, and they would have to do that through their health information management services, where they submit a request, and then health information management would define whether it could be released or redacted, etc. But people have the ability to access that if they so choose. Is the prescription record in MySaskHealthRecord based on dispense record from community pharmacies? So that is any of the prescription information is sent through our pharmaceutical information program. That's the source where MySaskHealthRecord picks that up from. So anybody that is submitting information there, that information will flow down to MySaskHealthRecord. There is hospital medications there as well as cancer medications come into our system as well. There are certain instances that certain medications do not come into MySaskHealthRecord if it was from some primary care physicians that aren't hooked up to provincial systems, and there may be others as well. So it's not absolutely everything, but it is very, pretty comprehensive. And there's a few other questions here. One that says, I like the PTs can enter data like a diagnosis for a procedure test. Can the patient entered information be verified or validated by an MD? As of right now, providers can only see this information if the account holder shares that information with them. So, a patient could come in with their MySaskHealthRecord on their phone and discuss it with their provider. As of right now, providers don't have access to MySaskHealthRecord user entered data. Any of the provincial data obviously is accessible by providers within the portal, but as of right now, user entered data is not.
I believe this next question is for Waldo, so I will read it for you. It says, when will the next Infoway patient survey be carried out?
Thank you for this question. As I mentioned, it's an annual survey, the Canadian Digital Health Survey, and we are going to start planning the next iteration during the fall, and we should be able to be in the field around October, November, and the results will be available the year after. So that's the plan for the next iteration of the Canadian Digital Health Survey. But just so you know, we also have other surveys, clinician survey. For example, we've just released the results from the 2023 nurses survey, and we've just wrapped up our survey, our physician survey, and then the results will be available around September. So thank you.
Thank you, Waldo. And I believe the next question, yes, it's for Gord. So it says, thank you for the informative overview. How is eHealth taking measures to ensure that all records are captured accurately? What should an individual do if they find incomplete information?
That's a great question. Thanks. My team also takes care of any of the tickets that come in. We do have a service desk that will triage information. We do have a MySaskHealthRecord service desk that can answer a lot of registration or other questions about data that's there. If there are problems with some data that does come into MySaskHealthRecord, and indeed it does happen, because MySaskHealthRecord displays information that we receive from source records. So again, the source for labs or the source for prescriptions or anything else like that. If that data was entered incorrectly at the source, it will flow down to MySaskHealthRecord. The patients themselves are the best quality check for any of that information. So that we receive those tickets, we investigate them, we find out if there is a problem, and if there is incorrect information, we will move that up to the program area that is responsible for that data to get it corrected and or removed from MySaskHealthRecord. So yeah, we do have a good, robust service desk team that takes care of those data problems.
Thank you. I believe this next question could be for Gord and Waldo. It says, has there been any discussion of a national platform for health records? So if you guys have any insight or ideas, please feel free to share.
Well, let me go very quickly here. I know that there's been a lot of discussions around it, and I know that there is some potential for having consistent rules around having, what platforms there are out there, having the ability to have an interoperability standards set. I don't know that there is specifically one plans for one platform completely across Canada, but that certainly would be something that would enable transference of personal health care data from province to province and potentially, internationally.
Yeah, just to add a couple of ideas. Yeah, I don't know if there is a plan to have one centralized platform where primary care physicians or clinicians, they can access health information. But what I do know is that through our shared pan-Canadian interoperability roadmap, we are trying to create a more connected healthcare system where clinicians, they can have seamless access, or they can seamlessly exchange patient information with other healthcare providers within the Canadian healthcare system. So that's all I can say.
Thank you, Waldo. So the next question, I believe it's for Gord. For a care provider to be able to read and write in the patient portal, I sometimes get concerned that this can be a privacy issue. How often does the consent need to be given by the patient for others to be able to read and write?
So when users sign up for MySaskHealthRecord, they do have to read our terms and conditions and the privacy statement. And if they agree to it, basically all of the onus is on them to make sure that they are sharing and allowing access to their account based on what they choose. Again, we don't, right now, the share functionality isn't really shared that often with providers. It would be the exception to the rule right now. Mostly it's with family members and like other people close to them that are helping to care. So again, that hasn't really been that much of an issue. That is something that we obviously do take very seriously and take steps to be concerned about. But as of right now, that hasn't been a large issue.
Thank you. The next question is also for you, Gord. Would this portal system be considered the most advanced across Canada?
Well, kind of tough for me to answer that one. I mean, we did do a lot of jurisdictional scans around what is out there, especially as we're developing our digital front door. I can say that we probably have the most amount of different kinds of data available in MySaskHealthRecord, and we are improving it all the time. There are other areas within Canada that have gone deeper with certain types of information, like specifically open clinical documents. In BC, they have done a lot more in that respect. But based on kind of our overall general information, we do have a lot of information that is available to people, again, striving to improve it all the time. And the fact that we also do offer child records, which I believe is unique in Canada at the moment.
Thank you. Another question. Is there an ability to record patient sex and gender, and for this information to be made available with anyone they have shared access with in the My Profile view?
Honestly, I would have to take a closer look at that. But ultimately, again, the sharing function, it is up to the individual what they want to share. They can be very granular with what they want to share. So they can share all information. So whatever they would enter into their platform would be able to be shared, or they can go very closely and say, no, I'm only going to share my medical information, or I'm only going to share my family history. They can pick and choose with a check mark to decide what they want to share. But basically, it's up to the account holder to share what they want. Let's see, probably the next one is also for me too.
Yeah.
Individual moves to another province apart from Alberta and Saskatchewan, how the service providers of that province can access the data and contribute. As of right now, we don't have any interoperability right now. So that's something that we would be looking to do. We are working on interoperability between Alberta and Saskatchewan, because there are a lot of people that access healthcare in border towns like Lloydminster, where they get certain tests done on the Alberta side, and they want that to be reflected in their MySaskHealthRecord. So we're working with TELUS to be able to port that information back and forth through electronically, or through other, like even downloading a spreadsheet and then importing it into MySaskHealthRecord. But as of right now, there's nothing beyond that.
Thank you. Next question is also for you. What was the budget of the program to date, if you are free to share?
I would have to take that one away, just to get all of the where we're at and how much what the budget is spent. This is supported by the Ministry of Health here, so again, I would have to compile that and share that after the fact.
Thank you. Another question for you. Do all primary care providers use the same EMR type across Saskatchewan, or do you have to integrate many different systems?
Right now, there are two main EMRs that are in use in Saskatchewan, but EMR data is not integrated directly to MySaskHealthRecord at this point. The EMRs are integrated to the provincial systems, but for information to come down to them. But right now, it's not connected with MySaskHealthRecord.
Thank you. And then this is just a follow-up question just for confirmation. So if a patient is sharing their data from MySaskHealthRecord, the healthcare provider is seeing it through their own version of MySaskHealthRecord and not the EHR.
That's correct. So that healthcare provider would have to have a MySaskHealthRecord account. The original account holder would have to share it with them, and the healthcare provider would have to accept that sharing function in order to see that. So it is not shared electronically with the provider portal or anywhere else. It's just from MySaskHealthRecord account to MySaskHealthRecord account.
Wonderful. Okay. A few questions. The integrated devices seem like an interesting option for remote patient monitoring. Is there any talk about integrating AI to flag if there are any symptoms indicating an issue with patients' health stats they are feeding in?
Great question. We are working on that potentially with our digital front door solution that we've been investigating and working on, and we have like a kind of a roadmap to try and bring that in. That would be something that potentially would fit into that kind of platform. And so yes, we have been taking a look at that, and that is something that we've identified that would be very helpful for patients tracking personal health for sure.
Okay. Our question, what is the role of TELUS in supporting and maintaining the health record system?
So the platform itself is supported by TELUS. We work together with them closely on any enhancements. They work with their development team to create new functionality and enhancements. And anytime that we get accountabilities that we want to do, we work together with them to see how we can do it, integrate our systems. But yeah, they support the program. They support the platform itself. If there's any issues with the platform, we look to them to rectify it. And I can say that I think I do track what our availability is, and I think for last year we were right around 98%, which would also include any scheduled maintenance. So they do a really good job of supporting the platform.
Thank you. Okay, I think being aware of time, those are all the questions we're able to get through today. If we were not able to get through yours, we will be following up. But I'd like to thank Gord and Jenna for taking time to speak with us today and share their presentations. They're really insightful and very valuable. We hope everybody who joined in had a great day. We thank you all for connecting with us, and we hope to see you again in another upcoming webinar. Have a great one, everybody.